I will talk about Turkey, and I will give a short picture of Turkish people or women in subheadings. Our households are decreasing. You see, since the last 30 years, our households decreased to 3.6 people. You see women living in urban areas, 81%. 12% of them have no education, and 68% are married still. And this is the distribution according to ages. Only 31% of the women work under Social Security umbrella, and by sectors, mostly work in service sector, 61%. The mean fertility is 2.2%. And of course, it's higher in the non-educated group. It's about 3.7%. The mean fertility in years is decreasing, and after 2008, it's increasing a little bit. And this is the age of marriage at birth. You see, 7% of the women between 15 and 19 years of age are married, and 73% of the women marry between the ages of 15 and 49 years of age. When you ask them the ideal number of the children, they report that it's increasing by our politicians want more children, so they think that the ideal children is about 2.9, about 3. So, how about the adolescent deliveries? It's decreasing. Hopefully, it will decrease more. Now, in the last 20 years, it decreased from 10% to 4.6% in Turkey. What about nutrition during pregnancy? You see that 94% of the women had antenatal care during pregnancy. We have family practitioners. All the practitioners had education for 1 month, and they become family practitioners. And now, 100% of the Turkish population are covered by these family practitioners. When you go and type your national security number, you can see the address of your doctor, and they should reach you. It's mandatory during pregnancy. If not, doctors have reimbursements, and they cut the salary of the doctor for that, if they cannot reach the pregnant woman in their area. You see, this worked, of course. 89% of the women had more than 4 antenatal visits during their pregnancy. This is the antenatal care, birth attendance, and place of birth. Now, 97% of the women had antenatal care. 97 of them were delivered by a midwife or a doctor, and 97% of them delivered in a healthcare facility. There are several programs that are applied during pregnancy. One of them is Iron Like Turkey. All women without evidence of anemia should take 40 to 60 milligram of iron treatment after 16th week of pregnancy. Whenever there is anemia, they should have 100 and 20 milligram of iron, and this is the mandatory regulation in the antenatal care directory, which was produced by Ministry of Health and also by us. This is a very specific algorithm how they should act. All family practitioners, when should they start? Should they start? Another supplementation nationwide is vitamin D supplementation. Every woman, without checking active vitamin D levels, should be provided 9 drops of vitamin D, which is 1,200 units. This is also mandatory, and all family practitioners should advise their patients. Iodine deficiency, I don't agree that iodine salt is the answer for iodine deficiency. I will explain This is the Turkish demographic health survey. You see in 2003, 70% of the people in Turkey were using iodinized salt. Now in 2008 and 2013, it's not written here, but more than 90% of the people in Turkey uses iodinized salt. But this is the last 3 years studies. Mild to moderate or severe iron deficiency in pregnancy was reported in 50 to 70% of the women despite their use of iodinized salt, because there are also regulations that you should decrease salt intake during pregnancy, you should restrict salt intake to prevent hypertension, and also providing iodine is not well. Almost 65% of the salts were tested in Turkey, and they do not fit the regulated concentration of the iodine. So place of delivery is healthcare facility in 97%, and 93% of the women and 94% of the babies get postpartum care in Turkey. You see the breastfeeding, at least the mean breastfeeding in months is 1.2 months, but so they try to only breastfeeding is 1.2 months, but women try to give breastfeeding plus extra supplementaries in the meantime of 16 months. No breastfeeding in the first 6 months is only 8%. They are fed with supplementaries only. BMI of women more than 30 is about 27% in the new Turkish demographic health survey. And I should mention that the most important risk factor for obesity in women in Turkey is delivering a healthy child. This applies to our tradition that women should double their eating because they have 2 hearts in their body, and also for milk they should eat double. So they eat more and they cannot lose weight after delivery. The odds is about 10 to 20% higher risk factor. Vitamin D deficiency, there was a big health survey in Turkey, and about 70 to 80% of the women are vitamin D deficient. This was done in postpartum period together with their children. So it is, you see, it is a severe vitamin D deficiency. So vitamin D is applied to everybody. Nutrition during pregnancy and postpartum period was studied with a Turkish-wide, nationwide nutritional survey. And you see the pregnant women, they skip lunch. In 16% of the women skip lunch. And during breastfeeding, 17% skip lunch. And what is the main reason they skip lunch? 15% is economic, about 15 to 16% is economic reasons. They skip lunch. You see milk and milk products was increased, the consumption is increased in 50% of the women during pregnancy and 40% of women during breastfeeding. But unfortunately, it could not be applied to the meat products, especially the red meat. But egg consumption is increased in 40 to 30% of the women, and fresh fruits and vegetables was increased in 66 to 40% of women during pregnancy and postpartum. They do not consume alcohol, and only less than 5% consume tobacco. You see, they increase 20 to 30% increase sweet in their diet, and also drinks with sweet, so they get a lot of calories which will not work for them. No consumption of these was listed here. You see 28% do not consume any meat during their pregnancy, red meat. And 48% does not consume any fish. So omega-3 is not, I think, enough in our society, because the fish is consumed only in the fishing season, which starts from August till December. See, 80% are using tea regularly every day. They drink tea. This is the reason for iron deficiency. And 30% are using olive oil, and 70% are using other oils. The mean calorie intake of pregnant women is 1,736. It's pretty enough for more than 50%. For the nursing, it is 1,862 calories. You see, the supplementation used during pregnancy and postpartum, although it's mandatory to provide vitamin D, only 7% used vitamin D, but this was the survey in 2010. It's about 30% now, I know. The 42% of women used ferrum supplementation during pregnancy. This should be around 50 to 60% now. And multivitamins, 30% use multivitamins. And if you go to your family practitioner, they provide multivitamins without any money. In Turkish law, pregnant women can deliver in any health facility, including private sector, and they should not be asked for money. If they cannot pay, the government pays for it. This is their right. They can deliver in any health facility they want. Also, only 15% used folic acid during pregnancy. We have some opportunities. I'm sorry, it's a bit long, I think. Safe motherhood, contraceptive consultation. We have reproductive health modules applied still today. We have adolescent reproductive health and introduction to reproduction modules. We have mother-friendly hospital initiatives started in 2012. I was also in the advising committee. We have 3 pilot hospitals now. What is mother-friendly hospital? They should provide antenatal education classes to all delivering women. This is mandatory. So we are planning to increase this nationwide. Reproductive health centers, we have 92, and in 81 provinces. We have 14 regional reproductive health education centers. They have anatomic models, computers, educational models, and booklets. So we should include reproduction and nutrition in these classes. 1,565 doctors were educated for giving healthcare services, and 2,384 nurses or midwives or emergency care technicians were educated in 2014. This was in the last 10 years, 33,000 women had these educations from nurses or doctors. Also, we are educating men. Since 2002, 3 million men were educated during their military service, a one-day program about anatomy of reproductive organs, physiology, safe sex, family planning, safe motherhood, social gender, domestic violence, sexually transmitted disease. And this program could also include nutrition guidelines, I think. So in summary, there is enough data extracted from Turkish population to take action, and Ministry of Health programs should involve a nutrition heading or chapter. Although there are good initiatives undertaken, they should be monitored for prevalence and universality in the country. Thank you very much.